I would like to introduce you to the patient who requested orthodontic treatment to decrease her non-axial load on her teeth and who was concerned with her lower anterior teeth, especially periodontally compromised. And as you can see, there are multiple sites with indirect evidence of periodontal attachment loss. In her case, although we could appreciate that she was almost class 1 on both sides. So this T-scan was taken before any treatment was introduced on that patient, and what we can see is that there is severe force outliers on number 15, which is 27 in the European nomenclature, and on number 3, which is 16. And these all happened in centric occlusion before she had any treatment on her. When we go further, so what we did in this patient, we did not bond lower incisors at the start of treatment. So our intention was to have her posterior, lower posterior teeth distalized prior to alignment of the lower anterior teeth, and we did that and accomplished that successfully with the use of the micro implants on both right and left sides, with distalization starting from lower canines. And at some point, at approximately 6 or 7 months into treatment, the patient came into my practice saying that she has some pus coming out from around her number 3 on the upper, and she was complaining of not being able to chew on that side, and she was complaining of severe pain, and she was asking me to do something actually. So the first thing I thought about was that due to distalization mechanics, we often use some occlusal buildups on the upper first molars or lower first molars to make the teeth disclude prior to treatment, prior to applying any type of distalizing force. So the same type of occlusal buildups were placed on her number 3 and number 14 correspondingly, and I checked her number 3, which she complained of, and I didn't see any suspicious things, but she kept complaining. So I tried to adjust it, just eyeballing which context should I touch, and it didn't help much. So I took my T-scan and I tried to look for any contacts in her centric, in her protrusive movements, in her left lateral, and then when I saw her right lateral, this is the picture, this is the screenshot of her right lateral, and you can appreciate that number 16 on number 3, whatever you prefer, has 70% of force in her late disclusion, in her period CD disclusion time period. So this is actually this is the movie playing, and as you can appreciate, she moves to the right, and the almost 100% of force was located on number 3 or number 16, whatever you prefer, during the right lateral movement. So after adjusting these contacts in this patient, we could achieve almost none more than 10% on her number 16, but we would never know that without using T-scan, and that took her out of her pain almost the same day, and she didn't complain anymore. And the next appointment she came in, everything was healthy looking and pinkish, and of course we removed the occlusal buildups, but this took us what took us to recognize and to understand that the problem was actually the occlusal problem contributing to that periodontal involvement and periodontal abscess that took place in this patient. So this is a very short abstract from my lecture on T-scan and orthodontics, and I would like to introduce you the full version of that would be available in a couple days, and I would post that link underneath this video. So please watch for that, and you will learn a lot of interesting details on how to utilize T-scan in your daily orthodontic and general dental practice. Thank you for watching, and subscribe and like the